parents and babies. As pediatrician, your role extends beyond treating children's physical health. You are trusted guides for families navigating the challenges of raising emotionally healthy children, so relevant today in a world that is so rapidly changing, highly competitive, aspirational, and social media validation seeking. Today, we'll explore the profound impact of parenting with emotional intelligence. With this endeavor, our topic for this web CME is parenting with emotional intelligence. We are delighted to welcome our speaker, Dr. Sandeep Kelkar, sir, an eminent
Good evening.
pediatrician, an eminent pediatrician and EQ coach pioneer from Mumbai, India, who will bring practical insights into this burning topic. Dr. Sandeep has more than 3 decades of dedicated pediatric practice at a self-owned hospital and presently the director of Department of Pediatrics at MRR Children's Hospital, a 115-bedded super specialty pediatric hospital in Mumbai. Dr. Sandeep Kelkar is the founder director of Equipoise Learning, the emotional intelligence research and training organization, which is ISO certified as well as IQC UK certified. He's an EQ coach, Gottman certified relationship coach, mindfulness practitioner, and trainer. Dr. Sandeep is a visionary behind the innovative concept of EQ as a psychological vaccine for children, a groundbreaking idea which he had presented at Howard University during an international conference on emotions and emotional intelligence. Dr. Kelkar's insights on emotional intelligence have garnered international attention, leading to invitations to speak at prestigious events, including the one at Howard University, as a faculty to conduct workshop on emotions and neuroscience, and he's also addressed the Indian Army at the Jammu headquarters. He's invited on the board for the NCERT Maharashtra for developing and guiding curriculum for CBSE schools, and he's a chairperson of the school mental health module of Sankalp Sampurna Swasthya, an IAP initiative at national level catering to 400 schools in 20 states across India. As an acclaimed author, Dr. Kelkar's contributions to literature include an award-winning book called Zave Bhavanatsya Gava on parenting with emotional intelligence. Dr. Sandeep Kelkar, thank you so much for your valuable time today, and the stage is all yours.
Thank you so much for that kind introduction. And it's a privilege and honor to be here on this platform and addressing pediatricians. I am being myself a pediatrician practicing for last more than 3 decades. This concept of emotional intelligence and how we can apply it in parenting, and of course for pediatricians themselves in the office practice, and then utilize this concept for their own, for the little patients as well as the parents, to guide them, to counsel them, to deal with emotions in themselves as well as in children and caregivers. This concept is going to be really important. And thank you so much for this opportunity. And I would like to start straight away with the presentation and my talk. Just give me a few seconds to open. Okay.
Yes, sir. We can see
So
yourself.
this is the topic, and as we all know, that 21st century is century full of challenges, especially for parents, and parenting is not very easy. And unfortunately, when the children are born, we call them a bundle of joy. But then as they grow, sometimes they become bundle of problems. And actually, as pediatricians, we are observing and watching children right from birth many a times. And then we see them growing with a lot of emotional health issues or mental health issues and mental illnesses later on as they grow up into adolescents and teenagers. So our role as pediatrician is very vital, because we can use certain concepts which are very novel, very new in modern psychology. Like, for example, this concept of emotional intelligence, we can utilize this while doing our office practice also for ourselves as well as our little patients. And this can be really something which will be not just theoretical, but we like to make it more practical during the whole session. And my agenda will be very simple, that these are the key takeaways which we'll be getting at the end of the workshop, and the end of the webinar. And of course, we all know that the emotions really matter, and they matter a lot, not only in the at a family setting or home, but also during office practice in the clinic when we are sitting as pediatrician. As we know, and clinics and hospitals are full of lot of intense emotions, emotions in us as pediatricians, emotions in children, emotions in caregivers, and we have to somehow identify and deal with them effectively. So they really matter. And our decision making as pediatricians, as well as when we counsel the parents and deal with their emotions with a lot of empathy and a lot of understanding, we have to use certain skills which are beyond IQ. And that's what we are going to deal, and we are going to go into deeper. But why do we need this parenting with emotional intelligence in 21st century? That will be also dealt with during this webinar. Few of you may not be aware of what this concept is. What exactly is emotional intelligence? So I will give some time to go in little bit of depth of this conceptual understanding of this EQ or emotional intelligence as the concept, and then what we can do as parents or what we can do as caregivers and even pediatricians to emphasize the importance of emotional intelligence in parenting, especially in 21st century. Because 21st century, this concept is really the need of the hour. As we see a lot of things which are happening all around us, where rising stress is there, rising mental health issues are there, then rising competitiveness, and of course rising depression, which is creeping into childhood. And we need to do something to foster mental health or wellness in children, and we can guide parents to foster this by doing by knowing about this concept ourselves and then applying it in office practice. Of course, I will be taking one or two important case studies which I have encountered in my office practice. And of course, we will end up with telling you 10 tips to raise an emotionally intelligent child, or how we can guide parents to raise a child who can be more emotionally intelligent. So that will be my quickly my agenda for today's talk. So let's move into what are the major parenting challenges as we are uh, navigating through 21st century. And we know that these children are growing with a lot of things which are happening around them. There is the effect of media, the social media, the digital, the mobile, and all the gadgets which are there all around them. Attention is a main issue. Focusing is the main issue for children as well as all of us. And then, of course, it gets into replicated into all other things like behavioral issues, emotional issues, academic problems. But the major parenting challenges, which normally all of us will encounter as pediatricians, and especially when parents will come to us, these will be the major challenges. I hope you can relate to these problems which I have mentioned on this slide. Many of the parents will come with this concept that, this complaint that my child is not able to focus and concentrate. How do I improve my child's concentration and focus? My child is, I want to spend a lot of quality time with the child. How do I do that? What is exactly the formula for that? How to deal with children's irritability, tantrums, difficult behaviors, especially in early age as well as in teenage? What to do if my child is not motivated to study and he has difficulties and academic issues? How to face mood swings in children and teens, which are so common, especially in teens? How to deal with anxiety and worry? Some children are really anxious, especially before exam, before any kind of major obstacle. So they get really worried and anxious, and they can have a lot of symptoms because of that. How to monitor and restrict children's screen time, which is a kind of hot issue for all the parents, and they will come to you with this issue or challenge. How to set family routines to keep work life balance, because many of the parents will be working and they will be finding it difficult to have a kind of balance between their work and life, and giving time to children, and then helping them to not only thrive but flourish in life. So we'll have to address that also. How to deal with child who doesn't listen. isn't it? There's many times these parents will come that my child is not listening to me. There's a lot of things I try to tell him, poke him, but then, with all the things, he's just not listening. How do I deal with that? So that can be, many, many more challenges which you can come out with. But I'm sure that all these challenges you will really relate to, because many of the parents will always come with these challenges to us. How to give an outlet to pent up energy in children, especially in initial years with a lot of energy, and they are sometimes labeled as hyperactive children, but they are not actually hyperactive. They have a lot of enthusiasm, curiosity, and energy, which doesn't get properly navigated, or outlet is not there. How to communicate with children and teenagers, because that's the major challenge, because the time spent by the parents with the children is mainly important when there is a conversation which is really congruent, and which is really constructive and healthy. And how do we have this communication which is more congruent? And that also we will try to deal with in today's talk. So these parenting challenges, if you see, how many of them are related to emotions? If I may ask you, and most of you will agree with me, almost most of them are, all of them are related to emotions, isn't it? And so that's why we need to have, something, some strategies, some skills where we can actually, deal with these emotional challenges in a better way. So do really emotions matter? And the answer is assertive yes. They really matter, not only at home, in the family setting. It really has impact on all of us as pediatrician in the clinical setting also. If you are working in a clinical setting where there is, hospital based practice, or intensive care unit, you will definitely assertively say that, yeah, there is a lot of intense emotions which are there, and they are impacting all the time all of us. How does these emotions impact us? They impact us as well as our children in many ways. They impact our attention and memory and learning. They impact our decision making capacity. They impact our relationships. And of course, they impact our creativity, innovation, and of course, last but not the least, our mental and physical health. So as a pediatrician as well as a children, the emotions really matter. The emotions are same whether we are adults, or even the little children. They also face similar range of emotions throughout the day, and that has got impact on their body as well as mind as well as mental well-being. So we need to see that something should be done where we can train them, or we can train parents, or we can give some information and knowledge to parents, so that they can, it will be really useful for parents to uh, do the parenting with confidence, with competence, and with lot of emotional intelligence themselves. So if we can have certain things which are, share information with them, then it will be really good, because they will be coming out with these problems every day, and day in and day out. So we have to identify where they are coming from, what are the emotions underneath, and then deal and give them guidance accordingly. And I'm going to tell you about how we can deal with that very effectively. Of course, those children and students who are literate, or those who have been trained, those who are skilled in emotions, for example, we call them as emotionally literate children. They have higher quality relationship, they are less anxious, depressed, they perform better in school, and of course, they have lesser behavioral issues. And all these challenges, if you see, which we have seen in the last slide, they are all boiling down to ultimately some skills related to emotions which are missing in that child. So we'll come to that in short while. But then why do we need 21st century parenting with emotional intelligence? Because we have to give a different kind of paradigm to our parenting. Because parenting, as we know, we have a lot of goals, a lot of things which we want to see our children to be doing. We want children to be really responsible, independent, We want them to be stronger and resilient and face the ups and downs of life. We want them to be really motivated to do a lot of things and then ultimately be happier and successful. But all that is possible only if we have certain parenting tools with us, certain parenting strategies with us, which are basically are skills which are related to emotional intelligence. That's why in this 21st century, especially, we need to change, give a new paradigm to our parenting. And that's why we need parenting with emotional intelligence ourselves. Because all the time, children are watching us. They are like a radar and they are kind of, watching how a parent is dealing with his or her own emotions. What has been done, we are like role models, so we have to walk the talk as well as walk the walk, and we have to uh, ourselves deploy all the skills of emotional intelligence while parenting. Our parenting will be really effective if we do that. And that's why we all should understand the concept of emotional intelligence as well as how we can apply this concept while parenting. So we will go to a little bit about what exactly emotional intelligence is. Emotional intelligence concept is there for last 4 to 5 decades almost in the field of child psychology. And this concept is now been in the fourth or fifth decade has been now utilized all over the world for building mental wellness as well as building the mental health of children as well as adults. So this concept basically is nothing but a unique intersection between emotions and intelligence. And there has been a lot of models and a lot of definitions which have come up, because if you see first, this word look like an oxymoron, isn't it? You will see that there are two opposite words, like two opposite words coming together. How can emotions be intelligent and how can intelligent person be emotional? But it is not that. It is actually how we intelligently apply our skills to our emotions as well as others emotions. So intelligence applied to emotions in short is emotional intelligence, and these are skills which are beyond IQ, because you may be cognitively or IQ wise really very high IQ or very even genius, but if you lack certain skills which are related to emotions which are beyond IQ, then you may not be very effective as parent, as a professional. Just take an example of uh, before coming to what EQ is, we should know that what EI or emotional intelligence is not. It is not opposite of IQ. It is actually complementary to IQ. It is not about controlling emotions. It's about managing, regulating emotions. It is not about some personality traits, though emotional intelligence skills ultimately will influence the personality of the child as well as adult. It is not about always expressing emotions. It is not a touchy-feely concept. It is a very scientific, very well authenticated concept with robust research, neuroscience behind it, where it is expressing emotions at the right time with the right person in a right way. That's more of emotional intelligence. So we don't call an emotional person as emotionally intelligent. Actually, being emotional is not emotional intelligence. It should be more of a sensitivity. If you are sensitive towards others emotions, then you may be having a little higher emotional intelligence. But being emotional is a actually indicator of a lower emotional intelligence. It is not about therapy. We are not giving kind of this emotional intelligence while parenting as something which is therapy for only for select few children with problems. It's not. It's a universal concept which can be used as a preventive concept to prevent a lot of problems rather than as a therapy. So I fondly call it as psychological vaccine. It's a kind of a skill set which, if imparted to children right at early age, will act as a vaccine or immunization against many psychological, emotional, and behavioral issues which child can face later on. So we have a lot of window of opportunity as pediatricians because we see children right from birth. So we can utilize this concept as a preventive concept. And it is not about being diplomatic. It is being actually being very transparent and showing your vulnerability. So as parents, sometimes we try to suppress things, we try to be, surface act few things, so that we have to see that we are happy, and we don't show our emotions, we try to cover them up, keep them under carpet. All this is not about emotional intelligence. It's actually, it is against emotional intelligence, and that's going to harm our own mental health as well as even children's mental health. So this is what EI is not. But all of us know that IQ as a concept is very famous. Everybody talks about academic intelligence. But what we are going to talk about is more emotional quotient or emotional intelligence, and how it can be applied in children. Because the reason is, there is rising, of course, issues which are there in children in 21st century. But more than that, IQ is increasing all over the world, but EQ, or emotional intelligence or emotional quotient, is going down. This is a universal phenomena which has been seen by scientists and psychologists. And this time is ripe that we need to do something. It's like elephant in your room that we should be dealing with, and actually focusing on emotional quotient of children right at early age. And for that, what we need is adult learning first. So first, pediatricians and the the parents, the caregivers, and the adults who are there, even teachers, should be aware about this concept of emotional quotient, so that then the child is ultimately, observes all these phenomena going on around him or her, and then learns about emotional intelligence by absorbing all these things. So what it is exactly? It is nothing but these four things which we can do about emotions. It's about emotional self-awareness, that is understanding, identifying my own emotions. As a pediatrician, as a parent, am I able to give word to my feeling? Am I able to understand and identify and recognize my emotions accurately at any given moment of time? So that's about perceiving emotions. Then it is about social awareness also. Am I able to identify emotions in others also? That's about empathy, where whether as a parent we need this skill, and as a pediatrician also we need this skill so much, of empathy, where we understand and tune into our patients or our parents emotions, and deal with them effectively. Similarly, as parents, we need to be very empathetic and have those skills of tuning into child's feelings, connecting with the child's emotional world, which is a phenomena which is so much important. Unless there is attunement of the parent with the child, there won't be any emotional and mental wellness in the children. So this perceiving of emotions in self and others is the first skill set. Then about how we understand these emotions. How do I know the cause of my sadness or anxiety, and then impact of this emotion on my life, or on my decision making as well as my behavior. So that's about understanding. Using emotions, how do I utilize these emotional states to guide my behavior, to have be more creative, to solve conflicts, and of course be more creative and innovative. So this is about using emotions. And of course I need certain skill set to motivate myself also, and then manage and regulate emotions. That's about managing emotions. So these are all skill set which all of us need as pediatricians, isn't it? And as parents, we can deploy these skills in children, in children as well as ourselves, starting with us. Now, as you can see here on this slide, you remember this movie? Anybody can put it in the chat. Which movie? And of course, these two characters, right? And on the left side, as we can see, is uh, the character played by Amir Khan. The character's name is Rancho, and on the right side is Virus, isn't it? Now just imagine this. You are a patient, or you are a parent who wants to go to a pediatrician. Just forget that you are a pediatrician right now, and you are a parent who wants to go to a pediatrician. And these two pediatricians are there. Just remember, these are characters, and these are two pediatricians whom you want to select one of them to go as a for your child. Whom will you like to select as a pediatrician? Rancho or Virus? And I'm sure that you will select, of course, Rancho because of lot of traits and lot of behavioral traits which we see in in both these characters. Actually, they have a very high IQ. But if you see, Rancho had a lot of other skills which are beyond IQ. He was poised, outgoing, committed to people, causes, empathetic, and caring. These are the skills which all of us need, right? And we will see in a person, so that we actually want to go with this person, or we want to be sharing information with this person. So as a pediatrician, can we inculcate these kind of traits in us by developing certain skills? And of course, a virus who was also very highly intelligent, but then he lacked emotional intelligence. He was low in EQ. That was shown in this movie, of course. I'm talking about character, not the actor. Critical, condescending, bland inhibitionally, and emotionally bland, lacking empathy. All these were the traits which were seen as a low EQ in this person. So to develop children's emotional intelligence, the first foremost things is we need to inculcate and rekindle all these skills of emotional intelligence in ourselves first. And as pediatrician, caregiver, as well as parent, we need to know what these skills are and how to do that. So what are these skill set which are very important and very fundamental? So I'm not going to go into details, but I'll just give the framework of this skill set and how we utilize this in our day-to-day life, right? So this has become kind of webinar where there is monologue. I will be talking to you and I will be telling you, sharing you some information. But then because it's not in the form of workshop or a kind of interactive thing or dialogue thing, we won't be able to actually interact here. But then I will be telling you 3 facts about these emotional intelligence skills, and then we'll come to the skill set which is important as parents as well as in children. First fact is, all this skill set is beyond IQ. So it is something which is not measured when we are measuring academic intelligence. These are all skill set which are beyond IQ. Second fact is, all these emotional intelligence skills are learnable, teachable, measurable, and enhanceable. So we can always have this opportunity to cultivate emotional intelligence in children by doing certain things. And third and most important thing is, these emotional intelligence skills start in a child right from early age, right from birth actually. They start developing in children according to certain timetable. They start emerging. Okay. So there are certain skills which start in first 2 years, then next 2 years, but then that's the window of opportunity. If we as parents or we as pediatrician tell parents what is to be done in first 2 years, which skills are emerging, and what you can do as parent to cultivate, to enhance these skills, that will be really an effective way. Like that's the basic concept behind the concept of psychological vaccine. As we are giving different vaccines which are right from early age, like we give polio, triple, and all those vaccines right from early age to prevent physical issues. So why not share information, give strategies, give skill set to parents for children, so that according to this timetable, we nurture and cultivate the emotional skill sets and emotional intelligence skill set in children ultimately, which will work as an immunization against problems. So what are these skill sets then? There are 6 set of skills which are very important as parents ourselves, as pediatricians, and these skill sets we need to enhance in children as well. First skill set is emotional literacy, and it's about knowing the language, words of feelings, identifying emotions accurately in self and others, and of course, giving a word and name to it, and expressing these emotions in a very constructive way. All these micro skills are there which come in emotional literacy. So are we emotionally literate really? As pediatrician or as any professional also, we are hardly given the understanding and opportunity to learn about emotions and these skills during our school age, in your graduation as well as post graduation. So we come out as postgraduates or as pediatricians with higher IQ, but sometimes we are not understanding, or we are not knowing about this skill set, we are not aware about this concept, and then we start doing our practice, and then at a certain time we get really stressed out, and we see a lot of burnout also in pediatricians as well as those who are doing intensive practice, just because we are not literate. We are otherwise literate, but we are not literate about emotions and emotional states. And there is a whole thing which, skill set which we can learn and teach. Then another set of skill is about emotion management, and that emotional management in self. How do I manage my own emotion? How do I regulate my own emotions? Is an important set of emotional intelligence skill. And self-regulation, it's called self-regulation. So we talked about self-awareness, we talked about social awareness, but now we are talking about self-regulation, managing your own feelings. Yeah, and that's very important. Then about empathy. This is about social awareness, that is understanding and tuning into others' feelings and able to deal with others' feelings also. So that is empathy. And of course, the set of skills which are called as relationship skills, where now you are managing emotions in other person. So that's required in a very healthy and successful relationship and happy relationships, isn't it? Because the person opposite you, maybe your patient or the little child, will have a lot of intense emotions. So do you have the skill set to manage or deal with those emotions? You may be having good set of skills which you can manage to regulate your own emotions. But what about others' emotions? That comes in relationship skills, and those skills which are required to make and keep intimate friendships. That also comes in relationship skills. Then the fifth set of skill, what is called as optimism. As we know, there is an epidemic of depression going on, and that's because, according to scientists, is because of what is called as epidemic of pessimism. The way we think in our head, the self-talk which is going on, many times it is very negative, very inaccurate, and very imaginary. So there are skill sets which we can use to change the way we are thinking, to be more accurate, more positive, and more realistic. Okay, so those are all skill set which are related to optimism, and the optimism skills can be enhanced, and that will help actually to prevent depression in children also. So, and the last but not the least, the emotion harnessing skills. So that is also skill set which is important, where how do we use emotions to motivate ourselves, then resolve conflicts, and of course solve problems also, the problem solving skill. So all these are set of skills, if you see, they form this concept of emotional intelligence or emotional quotient. And just see this. Just imagine if a child has deficient one of these skill, he will be behaving in certain way, which we call it as misbehavior or emotional issues. So many of them, as they are growing up, they have not developed these skills. We need to cultivate them. They are just emerging, but it needs cultivation, it needs enhancement. So if it is some of these skills are deficient, then that will get reflected in their behavior, in their general mental well-being also. So that's about the concept of emotional intelligence and what it is. And why do we need this? Because children with higher EQ have all these positive things. They are less impulsive, more focused, they are better in academics, they are self-assertive, they are better able to cope with stresses in life, more confident, less violence prone, popular in peer group, and generally happier and healthier. So these are all benefits of having higher emotional quotient. So why not utilize, as pediatricians, ourselves in our clinic, in our professional life, this concept, so that we get less stressed out, we are more effective as pediatrician, and of course use this concept for parents also to help these little children have higher EQ, because ultimately A child with higher EQ will have all these benefits. So let's go to the case studies now. I am going to tell you about two case studies. And this is the first case study. As you can see on the slide, Anushka, a mother of 6 years old boy, feels overwhelmed due to her job and family responsibilities. She often finds herself snapping at her son for small mistakes, which leads to frequent conflicts. Her son, feeling anxious, confused, begins to display behavioral issues at school, and there is an academic decline also. So this is kind of a case, and this had actually this mother and child had come to me, and because I am, I have some expertise in this concept of child psychology, mental health, and emotional intelligence. In such cases, we can actually deal with as pediatrician. Sorry. So as pediatrician, what I did was I found out, actually counseled this mother or parents, both of them. I interviewed both of them, the parents as well as child, separately, and spoke with this mother about what's happening in her life. And I could see there was lack of certain skills of emotional intelligence. She was not aware, she was not able to identify her own emotions. She was getting drowned by all these intense emotions. She was getting stressed out because there was job responsibilities, family responsibilities, and everything was so much chaotic that she was not able to manage herself. And this is all boiled down to ultimately a skill set which she was lacking, that is emotional literacy or emotional self-awareness. She was not able to be aware about her own emotions. And I gave her a tool set, a kind of toolkit called as Mood Meter. And that's an interesting toolkit. Because of time constant, I won't be able to give details of it. But I asked her to check in feelings throughout the day and find out where is she on the mood meter, where is she, whether she is really feeling all the negative shades of feelings, or positive, what is the energy levels, how unpleasant or pleasant she is feeling. Can she label or name her feeling and give a word to the feeling? And she lacked all that in that, but then by slowly practicing this feelings check-in as a tool, by just giving herself a few seconds to just sit there and reflect and use her mind's eye to go inwards and look at her emotional state and give a word to it. So we can ask this question to ourselves. So we can tell parents that you can ask this question, how are you feeling? Right?
So are you speaking? We lost your voice. Mm. Hello. Oh,
Okay, I'm so sorry. There was some technical glitch probably.
yes, yes, sir. Now
I'll
we can hear you
just,
again. Yes.
yeah, okay.
Yes.
Thank you so much. And sorry for that technical glitch. So I was on this case
Yes, sir.
and
Yes,
I
sir.
was talking about basically what skill set this mother needs to have a work-life balance. So emotional self-awareness is the first thing, asking herself and giving this tool of mood meter. And then, of course, emotional self-management or emotional regulation, When she finds out that she is really, really stressed out, finding the triggers. What is triggering her stress? If she is feeling overwhelmed, what are the things which are, not getting managed properly? Does she need support for something? There be integration between her family and the job? So all this needs to be, prioritized and actually, thought of. And that is only possible with self-awareness. Once she understands that and then understands what is causing these feelings of stress and overwhelm, then she will be able to regulate these feelings, because that's what is not happening in her, because she is displacing her own stress, her own anger on her child, right? And she's snapping on the son, and then that is causing even escalation of all these things, and that is getting reflected in the child's behavior. So when I counseled this mother and talked about this skill set, excuse me, when I talked about this skill set and gave her some tools to actually apply this skill set in her own life, she could, she could see the transformation happening in few weeks. She was less, you know, she was more mindful while parenting. She was aware when she was responding to child's temper tantrums, or, whatever child was showing the behaviors. She was more aware. She was able to manage her own feelings first, soothe herself, and then respond to child, which was more of a responsive parenting rather than a reactive parenting. So that helped child also. So the child felt really calm, and his behavioral issues went down. His attention improved, and that reflected in academics also. So all these ultimately boiled down to that parent deploying emotional intelligence for self, and that helped in child also. Child learned about, of course, child was counseled separately. He was also counseled with. We did EQ testing in him. We found out what's happening at the emotional skill set level, and then we could also train this child in emotional intelligence. So this was done parallelly, mother as well as a child training training in emotional intelligence skill set. So that was really a transformation, and there are thousands of such case studies which I have encountered in my last 2 decades of applying this emotional intelligence in office practice. I will take one more case. This was a father, Mandar, father of a 4-year-old girl, often reacts quickly when his daughter throws temper tantrums, and then over simple frustrations like not being able to wear her favorite dress. Her His reactions often escalate situations and making them more intense, which leads to feelings of guilt and frustration, both for him as well as his daughter. And this is a common scenario. Many of you will be able to relate, because we are so worked up sometimes as pediatricians also, some parents who are working, and they are not, they don't know, or they are not aware about how to respond to child's temper tantrums. So in this case, again, the counseling was done with a focus on parenting with emotional intelligence. Here, which skill sets were missing in this father? First was, again, there was lack of emotional awareness. There was lack of emotional management skill in this father, and lack of empathy also. He was not understanding and tuning into child's feelings when the child was throwing tantrums. And then if you are not aware about all these things, you will be more reactive, isn't it? Because these emotions will take over you rather than you being in charge of these emotions. So when you are having the skill set of awareness that, okay, I'm feeling right now really angry looking at my child's tantrums, and I need to first soothe down, calm down, and then respond effectively to this child. If I, in this anger mode, I respond, it will be more of reaction, and that's going to escalate. So this tantrum needed really self-calming for this father, and which was again taught to, it's through games and activities, and tools were given to this father to kind of first be aware about when he is getting, you know, angry, or these intense emotions are coming up in him. And then, instead of reacting, what happens when exactly we react? Little bit of neuroscience was told to the child, to the parent, and all this we can do it in in our office practice. We can give a separate time for maybe counseling, or maybe half an hour or 1 hour apart from our office practice, to this kind of things where we can train or give this skill set to parents. So when we take out time, because in busy practice sometimes it's very difficult to kind of actually talk about all these things when patients are waiting outside, but we can address this, that maybe we need to talk about it. We can say this to parent that we need to talk about this. Maybe it will take around 10-15 minutes, but find out a time and we will have a Zoom a call, or face-to-face discussion. So that's how I do normally, where I just have Zoom or online meeting with the parent, and talk about what's happening, talk about the skill set. And of course, I do more of coaching also, where I see these parents as really resourceful, and they come out with solutions rather than giving them solutions. So that coaching part also can be done as pediatricians when we coach parents in emotional intelligence. So when I did that with this Mandar as a father, uh, there was a huge change in the relationship of this father with the daughter. When she used to throw tantrums, he was more poised, and he was understanding what kind of tantrum is this. Because the tantrums are basically two types: upstairs tantrums and downstairs tantrums. The upstairs tantrums are intentional, vouching for your attention, and we need to ignore at that time and don't give attention, otherwise it's going to increase. And downstairs tantrums are where there are a lot of emotions which are evoked, and this terminology is because of the neuroscience behind tantrums. It's the brain science, that upstairs and downstairs. So when I talked about this little bit about what happens on brain when we get into reactive mode, and if you talk about this little bit and make the father aware what's happening in his brain exactly when he's reacting rather than responding, that gives him a kind of control over his own behavior, because he gets more convinced about the concept as well as how to apply it, and that really reflected on his behavior, and that improved the relations between Mandar and the daughter. And of course, there were lesser incidences of this reactive parenting in this case. So these and many more such cases, hundreds and thousands of case studies. We can have multiple major challenges, which we just now in second slide we saw about it. All these can be tackled by the way, by using emotional intelligence ourselves, and this concept of emotional intelligence as a preventive concept, understanding which skill set is missing in the child as well as parent, and train them and give them tools to enhance them. That will get reflected in their behavior. Okay, so last 10 minutes now, I will be mainly focusing on what are these 10 tips or 10 tools to enhance emotional intelligence in children by actually applying it in parenting. And that way we will be really parents with applying these emotional intelligence skills ourselves as parenting with emotional intelligence. So first tip, all of us know that home is child's school of emotion. Child is learning about emotions, how to identify it, how to manage it, how to express it at home. Because of course, 2/3 of the time is spent at home, 1/3 in the school. So school, I call it as home of emotions, and home is the school of emotions. So we need this concept both in both places actually, home as well as school. And In home, actually, as parents, we can learn to deal with our own emotions in front of child. That is so much important. If you are angry as a parent and you are snapping at the child, or you are shouting, you are very rude, can you expect the child to be really calm and very polite when he or she is angry? It's not possible, because they are watching us and they are learning from us as through parents. So if we role model uh, certain skills like managing our own emotions effectively in front of children, children will learn them, gather and absorb through us, and they will start using these skill set themselves. So this is the first tip we need to understand, is that they are learning about emotions through us. How do I deal with my emotions? Whether I label my emotions, whether I hide my emotions, whether I talk about emotions in a way, effective way, all these they are watching. If I am doing it effectively as parent, the child will be also will be skilled and will be able to actually apply it in his or her own life. So role modeling EQ skills is the key to parenting with emotional intelligence, where you yourself can use certain emotions which we can create more. Like for example, fun and humor can be created, right? And that can be done by role modeling our own emotional intelligence skills. Third important tip is, it's okay to say no to kids. Many times, in especially 21st century parenting, what's seen everywhere is we want children to be happy 24/7. That's a very good intention, but it can be harmful. Imagine you cannot be 24/7 happy, isn't it? Joyful and happy. You go through all range of feelings yourself as an adult, and even children go through. So it's okay to feel sad, disappointed, frustrated, little stressed out, because though these are all valid, normal emotions which spice up our life, and they are necessary. They are needed for our mental makeup also. So how do we give that message to the child that it's okay to feel disappointed and sad? We can give this opportunity by saying no to the child, isn't it? So when child is asking for something which is, you don't want to give, for example, a mobile or a cell phone, I just say no. This is not your time for mobile just now. So as a responsible parent, I cannot give it. That's it. One or two sentences and just say no very assertively to the child. Child is going to show lot of emotions, which is very natural. Child may become aggressive, child may become throw tantrums. All these are very valid, isn't it? We have to, at that time, really separate ourselves, detach ourselves from that child of ours, and look at the child as a child who is learning certain skills of emotional intelligence right now. So when I say no, the child is learning to face disappointment. He is learning to regulate his own disappointment. And if I don't give this opportunity and give everything to him immediately to make him happy, I am actually doing more harm than good, isn't it? As an effective parent, I need to let my child face certain negative shades of feelings. And that's a very important takeaway of this, whole webinar. Don't try to protect children from different emotions, emotional states. Trying to make them happy 24/7. Let them face certain emotions which are really intense. Support them. You are not going to neglect them. Support them, maybe respect and accept those emotions, but then you don't try to put them under carpet, don't deny them, but accept them and respect them. That's very important. And most importantly, don't judge emotions in children. Okay, because if you are judgmental about emotions in a child, that child is not going to express these emotions anytime to you, because he or she feels that it's very threatening and dangerous to talk about emotions in this family. because these people, adults here, are judging my emotions. They are denying my emotions. They are not, accepting my emotions. So why even express them? So such children become shy. They become, inhibited, and that's how they grow as adults who are all the time, burying their all intense emotions inside and showing them that themselves as a strong people, but they are actually really harming themselves from inside. It is important to be aware of your own emotions when as a parent, isn't it? When parents come, they are with children, they have their own set of emotions, isn't it? Because of a lot of things happening in their own life. Are you aware about your own emotions when you are doing parenting? If you are not, it's likely that they will get displaced on others. It may be spouse or even parents or even children. So if you are angry because of certain reason, and if you enter this house, and if your child comes and you are not managing your own emotions at that time, this anger is going to get displaced. And you see that many times that, this anger gets displaced on the child, and child becomes then really rude, and he displaces this, or he or she displaces this on his or her doll. So that displacement of emotions starts from us as parents if we are not managing our own emotions. So it is important to be aware and managing our own emotions in front of children. It's not that we should be solving all the problems for our children. Don't be permissive, overprotective, and don't solve problems for children. Let them find out their own, kind of solutions. So my guide and my always advice or suggestion to all the parents, as well as through pediatricians we are reaching out to parents, is that rather than telling children, ask them more. So probably, for example, if the child has thrown tantrum in front of you, rather than telling him to calm down, don't be angry, why you're angry, you're asking questions, you are trying to, instead of that, to accept that as an emotion, respect it, and say that I can see, beta, you are really, really angry. But when angry in our house, we don't throw things. And then when the child calms down after some time, ask him that, sometime back you were really angry and you were shouting, you were throwing things. What are other options? So now here you are giving the responsibility of the, managing as well as behaving to the child, that rather than you taking the responsibility of the child, this is how children will become responsible and independent. Because it is how we look at children, they will become like that. If we see children responsible, they will become responsible. If we see children as dependent on you, they will become dependent on you. This is a science, there is nothing kind of rocket science here. It's a very basic science of emotional intelligence, how we deal with children's problems. Then of course let them get involved in the house chores, and this is going to be really useful to them, because they learn about to get involved into the process of family, and the responsibilities of the family. Limit screen time. Screen time is kind of an enemy of emotional intelligence skills. So because when you're with screen, you're actually avoiding people, you are not having face to face moving with people. You are passively looking at certain things and the gadget, and it's absolutely ruining your mental health, digital health, as well as emotional intelligence skills are going down. So limiting your screen time of a child is extremely important. We need to put certain limits. According to the Indian Academy of Pediatrics, there has been time slots which are allowed for children. So no screen time below 2 years. I say that no screen time till 5 years. As much as possible, you go 3 years, 4 years, 5 years, try to avoid screen. Because that's the time when maximum brain development, brain growth is happening. And that gets hampered very quickly with the screen and the digital onslaught of lot of things which are happening in the digital world. So limiting screen time, no screen below 3 years. After that, supervised screen time, where you are with the child half an hour to 1 hour at the most, up to 8 years, or up to 5 to 6 years, around half an hour. And then after that, it is again kind of screen time, which is, sorry, uh, supervised, where you are, watching what is being done and monitoring it. And of course, there has to be rules set up about watching screen and watching cell phone. So that has to be set up right in the beginning before you give mobile to the child. And ideally, it should not be given to a child. And there are rules about social media use also. So all that should be, followed strictly as parents, which will help in uh, that will help in developing emotional intelligence skill indirectly, because the child will be now playing more with other kids, and of course spending time with kids, and that will help in through feedback in developing other skills of emotions. Talk about emotions freely in the family. We hardly talk about emotions. We talk about everything, isn't it? We talk about sports, children learn about sports. We talk about cultural things, children learn about cultural things. But do we talk about emotions freely? We don't talk about generally. And if we don't talk about them, children, they don't start expressing, they get shut off. So there should be some time given where we can sit together and just express your highs and lows of last 1 week. You can start with yourself, where you really felt high or good or excited, when you really felt, sad or depressed, and what was happening with you. And then uh, let everybody talk about it, and the child's turn will come. And initially you can allow the child to pass. And then in few weeks time, when the child knows that it is okay to express emotions in my family, everybody is nobody is not judgmental, everybody is non-judgmental, child will start expressing. So talking about feelings. So rather than asking the child when he or she comes back from school, what happened, you also add to it, how did you feel? Okay. And what were different feelings? And how are you feeling right now? So this is a very important conversation we should be having regarding emotions. Give them unconditional love, which is a base of everything. Love, trust, and the commitment as a parent, where we give this love, but we should not be spoiling the child also. Love is not, giving everything to the child. It is about being supportive, being caring, being understanding and accepting of their emotions, being respectful to the child's feelings, and then being very empathetic. That's love. And that is sometimes misused as, to spoil the child. And of course, we can have a feelings policy in our house, all of us, to actually impart, emotional intelligence and integrate emotional intelligence into the family. And what's this policy? Make a feelings policy where these three questions can be together. You can have a informal meeting and ask everyone, how do we want to feel as a family? And then few words will come. I want to feel cared. I want to feel respected. I want to feel safe, happy, calm, grateful. Hundreds of words will come where they would like to feel that way. Then second question, what can we all do to experience these feelings as often as possible? So now you are talking about an action plan for your feelings policy in the house, right? So everybody knows the action plan to feel respected, to feel safe, to feel happy. And then third is, what if the feeling policy is broken, or somebody is not feeling the way he should or she should be feeling? And then come out with their own options. What can we do about us together as a family? This brings the family together emotionally. The emotional climate of the family improves, and that helps ultimately in child also improving, becoming more healthy and happier. Of course, help children becoming emotionally literate. And how do we make them more literate? Of course, by naming their emotions. When they are feeling certain feelings, they learn about the emotion vocabulary, because that's a very important part of emotional literacy, knowing the words of feelings. And we can start that as early as when they start speaking, as 2 years. When they are throwing tantrums, instead of saying, don't, don't be angry, say that I can see that you are feeling angry and disappointed. So by labeling their feelings, you are actually helping them to understand and grow their vocabulary of feelings. So I would like to conclude. I'm sure there's been almost 1 hour. I could go through a little bit of introduction of parenting with emotional intelligence. I know there is a lot we can talk about, but the key thing, and that's the last slide which I'm showing, as parents, we need to understand that what we are doing in the family and how we are dealing with emotions, they may forget what you said actually, but they will never forget how you made them feel. So it's very important that we deploy the skills of emotional intelligence ourselves as father, as mother, as caregivers, as pediatricians who are dealing with patients and parents daily, to kind of let them feel respected when they leave your office. At least they let them feel accepted and cared, right? Because that feelings, those feelings, they are going to go for their lifetime. They may not look at your advice, they may not hear your advice or listen to that, but they will never forget how you made them feel as they leave your office or clinic. So that's very important. That's their choice intentionally we can take as pediatricians to apply emotional intelligence in our office practice. And this is in short about parenting. And our organization Equipoise, this is our phone number and you can contact us. We have a lot of programs for adults, for children, uh, and we have our organization who is working comprehensively on this concept of emotional intelligence and mindfulness for last more than 2 decades. And if you want, you can connect. If you have questions, definitely we will try to connect and share and support you. Thank you so much. This is just a last video. Sorry. If you have any questions, we can take up now. Thank you so much.
Thank you so much, sir, for a great session on a very unique topic. And thank you for putting out so much importance on and the context for emotional intelligence in today's times. And I think a very well context setting was made when you said that we are moving towards a world where psychologists are saying that the IQ is going up globally, but the EQ is going down in the larger population. And obviously, today's children are exposed to a lot of things, very fast environment. So thanks for such a very unique session and some practical insights along the way, along with case studies as well. The forum is open for questions. I think we have one question coming in, which has come to my DM is, how could a pediatrician attain any formal training in emotional coaching? Uh,
Yeah, yeah. We have our own set of modules, and we have programs on teaching emotion EQ coaching to pediatricians as well as those who are in the field of psychology. And of course, we have uh, courses, certification courses for that. We have certification courses on emotional intelligence also, to know the theory and practice of emotional intelligence thoroughly. We actually finished today only, we finished the one of the certification course, and we'll be having it next month also. So if anybody is interested, they can really connect with our back office and do it.
Sure. Uh, Thank you, sir, for that insight. And we have this very interesting question, which I think you are very uniquely positioned because you are a clinician as well as an emotional intelligence coach. Uh, the question is, what physical complaints are often encountered in children who are dealing with emotional disturbances in your experience?
Yeah, it's an interesting question, great question. Thank you for asking. We see that many times children come with lot of complaints, lot of things which are recurrent, needy. As a pediatrician, we do all the tests. We go in details of, asking history, examination. We don't find anything particular, and we call it as psychosomatic. But actually, it is everything is psychosomatic actually in the world, because mind and body is related. They are not different. They are same. So what is there in our mind is going to get reflected on the body. So a child coming to me with abdominal pain, and I'm not trying to find out anything in diagnostic workup, I go to the child and find out what's happening in his or her emotional world. Many a times I see anxiety, intense anxiety before, especially before exam, coming out as a, symptom of abdominal pain. Sometimes you have, intense anger coming out as, behavioral issues, as defiance, and then we label them as, some problems. Of course, we have to find out whether it is physiological or pathological. But then these emotions, intense emotions, if the children are not trained or they are not skilled, it will get reflected on the body in a different way. So anxiety, intense anxiety, if not managed properly by the child, can get reflected as abdominal pain. And if you just train the child in anxiety, make him more literate, the anxiety gets reduced and even the abdominal pain goes off.
Mm.
So there are many bodily symptoms
Yes.
which are also, coming out because of emotional turmoil or things which are not being managed properly by the child, because they are all non-degradable emotions.
Int- Interesting,
Yeah,
interesting.
so we need to manage them, navigate them, and
Yes.
utilize them.
Yeah, it's very interesting that a problem in pediatric practice so common like abdominal pain can have emotional baggage around it. And we have this question coming in from Dr. Rachna, sir. How skills can be taught to children from a young age to improve social skills and to improve emotional resilience?
Yeah, that's a very important question, because we can start as early as, we can start when they start socializing actually, when they start first 1.5 years, when they start walking and they start, meeting children, peer group, and we should allow them to play with other kids. That's very important. Okay. Don't protect them from, let them play with other kids. And then, of course, in first 5 years, it's a lot of our own parenting, how we are using our own social skills in front of them is going to, reflect on the child. Do we have ourselves friends who, we are more socializing, we are going with our kids with them, and then, having fun, having time together. And so all this is going to reflect on the child, and making them resilient is not a one-day job. It's kind of a huge process which starts early, where we start with, emotional awareness first. To become resilient, you have to have certain skill sets, right? A resilient person will have first emotional self-awareness. He or she will be really aware of about what's going on inside him or her. Then he or she will be able to manage properly and regulate those emotions, isn't it?
Yes.
That person will have, of course, motivation, intrinsic motivation. When the times are tough, how to motivate myself and bring myself up. So when I say resilient, there are many skill sets in that. It's not one skill set. So to see a child resilient as they grow up, we need to develop all these skill set of emotional management, emotional awareness, and of course, self-motivation, and of course, optimism. If a child is really pessimistic, thinks everything in a negative way, he will go down with one, defeat or one failure. This child just collapses, isn't it? Because he starts thinking so negatively that he is gripped in a lot of sadness and depression, and he's not able to motivate himself or others, and doesn't have these optimism skills. So all these four set of skills, if we try to develop, the child is going to have, more resilient in future as an adult. Hope that answers the question.
Thank you, sir. So, Dr. Rachna, I hope that answers the question. I think emotional resilience developing in a child is more a journey over a period of time. We have another interesting question coming in from Dr. Ashok Gupta. You may have covered a bit of this during your session as well, but are there any tips along these lines? How parents can encourage emotional expression and openness in the family?
Yeah, I just mentioned about a game we can play as family together, expressing our highs and lows.
Mm,
Okay, where everybody takes turn and then talk about their own uh, some situation in last 1 or 2 weeks where they played they actually felt really high excited, and one situation where they felt really low or sad or disappointed or depressed, and then let the child feel take the turn and talk about it. Second thing you can do is feelings on television game. So when a child is watching television, you know sit with him, and if suppose if the child is watching cartoons, there are a lot of emotions in the cartoon characters, isn't it? So to make this whole television viewing more active rather than passive viewing, just pause at certain time and ask the child, how is he feeling? How is this character feeling? If you were in that character's position, how you would have felt?
mm,
How would you express this feeling to me as well as others?
mm,
How do you manage normally these feelings? So you can start education about feelings by playing this game and feelings on television, where you are talking about the feelings of the character and asking the child to name it. And of course, you can do the same with stories also. When you're telling stories, the characters will be there. Pause at certain time and talk about the character. How is he feeling? How is the other character feeling? Okay,
mm.
then how would the story go according to you? How he will feel now next? Okay,
Okay.
you are in a way making him more literate,
Yeah.
educating the child in emotions,
Mm,
and then he will start feeling that these in the family it's okay to talk about it. That's how emotional expression becomes more
mm.
open. It
Interesting.
is not a one-day job again.
Mm,
We have to become open first with our own emotions. We start expressing our vulnerability in front of children. If I have done some mistake, I feel that, I'm really sorry and I'm really feeling sad right now that I did this. Talk with child in this way, show your vulnerability. That will improve
mm,
the relationship with the child, and that will be really a good bond, and child will start expressing later on his or her emotions very well.
right. Very interesting. So I think it's about over a period of time engaging in activities that stimulate the emotional circuits in a child. And it's a slow process
Yes.
and it's a journey.
Yeah.
Okay, we still have a couple of questions coming in, and I think this is slightly different. So we'll pick up this one coming in from Dr. Anil Kumar. What are the emotional challenges specific to parenting in low socioeconomic households? The where the challenges are more enormous, and some quick tips you can give us in this. It's a very broad question, but some quick tips you can give us in this direction. So,
Yeah, that's a very challenging situation because parents themselves, they are, their basic needs are totally different. Uh, they are struggling. There are other issues. Uh, they are struggling for the basic needs of hunger and all those basic needs. So many times what we have seen in such homes, children are more resilient and more emotionally intelligent than in affluent and educated classes. That's what normally seen because they are facing this day in and day out. And of course, if there is no feedback from the parent, it's not automatically get enhanced. But then the all the skill set and tools are same whether you are from low social economic background or higher socio-economic background, because ultimately it's about emotions which are universal,
mm,
and these skills are also universal. So maybe the context will change,
yes.
maybe the way it can be done, maybe it will be a little bit different than in higher or affluent class.
Yeah.
But actually, it should start with for everyone. We should not be looking at, of course, any of these things. But in
Interesting.
schools, right, if it starts early, it will
Mm,
help to
yeah.
cope up with whatever is going on in their world outside.
Interesting. So, though the dynamics change, but the modalities of approach remains largely same, and you bring out a very interesting point that sometimes these children, because of the environment they are in, may possibly come out with a more emotional intelligence or better emotional intelligence. And I think, sir, some questions you already answered during the session. So, I would like to take this last one before having your final thoughts. This is, can emotional disturbance hamper a child's academic performance, and how do we distinguish this from learning disabilities?
Uh, just come again. He wanted to know about.
So the question is, it's basically two parts to the question. Can emotional disturbance hamper a child's academic performance or learning abilities,
Mhm. Yeah.
and how to distinguish it from the learning
Oh,
disabilities as
okay.
a diagnosis
Great.
side, as a
It's a great
diagnosis?
question, actually. Thank you for asking.
Yeah.
Yes, we tackled this in one of my slides that emotions, they really matter. They have impact on everything, right from attention, memory, learning. So just imagine a child who's been bullied and is feeling anxious, fearful, going to school. And throughout the school time, he's all the time worried and anxious that I may be bullied or, really feeling fearful. Will he be able to learn anything in the class? Hardly anything, right? Because these emotions, overwhelming emotions of anxiety and fear, they are occupying the working memory of this child. And this child is not going to remember anything, is not going to learn anything because there is no, it's not going to go inside. So that's why Plato has said many years back, every learning has an emotional base. So when educating a child, rather than teaching them all the things, we need to teach about emotions parallelly also. Then only the learning will happen. So that's why many a times these children who are intense emotions and they are not being dealt with properly, they will look as learning disabled. Actually, they are not. They have good, learning capacity, but that is getting hampered because of these intense emotions. And now coming to the next second question, how do you differentiate it from learning disability
Yes,
and
yes.
what we can do about it? Of course, learning disability is something where, we have to observe, we have to take a detailed history with the parents and the child and find out, of course, teachers, and find out what's happening with his reading, writing, and mathematical skills and everything, and what's happening in their, in academics, because many times they come with some academic difficulties, and then we diagnose it as, having some kind of underlying learning disability.
Yes.
So we have to first differentiate whether it is learning this, inability or learning disturbance because of underlying emotions, or it is something which is, disability or disorder where there is reading difficulty, for example dyslexia, or there are, dysgraphia, dyscalculia, whatever. So there are specific learning disability, disabilities which are there, which can be measured and actually evaluated by psychological evaluation, by actually, learning the child's maybe psychoeducational assessment, where you understand what's going on in the, how the child is applying the skills in learning. So if there is some disorder there, we can understand and actually diagnose it. But there is a overlap many times, and we have to differentiate, as rightly said by this doctor.
Yeah.
Very well put.
Okay. So there is a bit of an overlap, and there are these screening tools which can help in differentially diagnosing this.
Right.
Thank you so much, sir, for a very comprehensive session and addressing all the audience questions. We would like to thank you for your valuable time, and we only want to utilize this platform to let you know that you are doing something very unique for the country's well-being. India has got the youngest age demographic, and it is very important as a country that the future needs not just physically healthy, but mentally and socially healthy society. So, wow. Thank you so much for your valuable time, and I'll leave the forum for any final thoughts and words from your side before we part of this meeting.
Final thought is nothing, there is nothing like perfect parenting. We all do mistakes. So if you are feeling guilty, embarrassed, I will say that it's okay to be imperfect as parent also. And it's most important thing in parenting, what I have learned is, if you have done something which is maybe inaccurate in the past, you can always go back and repair. So repair, repair, repair is the main thought. I think I will go from here telling all the parents that if something has been done where child is felt insecure or disconnected, go back and repair, connect with him, talk about what happened, make sense of everything and repair that wound. Don't put it under carpet. Don't see that automatically it will get healed. It doesn't. So go back and repair. So repair, repair, repair. That's the final thought from me.
Thank you. Thank you so much, sir, for reiterating that message. I think we are all work in progress. So is parenting. And thank you for your time and thoughts. And have a great evening. Thank you to all the audience for staying in there and asking some very good questions. Thank you, sir.
Thank you, everyone. Thank you for giving this opportunity. Thank you, everyone. And have a great day. Thank you. Bye
Have a
bye.
great day, sir. Nice meeting you.
Bye bye.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.